It's very hard to predict. I mean, what we're seeing is a really concerning situation in Scotland where the Office for National Statistics figures show that 1 in 18 people are infected, and that's the highest ever during the pandemic. What's concerning is that we're also seeing rise in hospitalization. So also in severe disease, of course, not to the extent we would have without vaccines, but even with the level of boosting we have in the population, there is significant pressure in hospitals. And ultimately, some of that will translate into deaths or early increases in deaths. And I think all of that is really concerning. I mean, certainly not just in Scotland. I mean, England is a few weeks behind Scotland, and in all of Europe, we are seeing rise in cases right now. And part of that, it will be related to the BA2 Omicron subvariant, which is more transmissible than the previous variant of Omicron. And partly it'll also be related to easing of measures that has happened pretty much all over Europe, including in Scotland. And unfortunately, the combination of those two things means that cases are increasing again. And I think there should be a warning to all of us that the pandemic isn't over, and we need to take long-term precautions to protect public against this, because it's not magically going to go away or become milder, and we have to manage the risk rather than sort of blinding ourselves to it.